welcome to another video of PharmD&Me. Today we're going to talk about Intro to Hospital Pharmacy, starting with staff pharmacist responsibilities. Being a hospital pharmacist is similar to what you'll see in the retail setting, so I know many of you have probably worked in retail, but maybe haven't worked in a hospital. So they're very similar, but they're also very different at the same time. So There something that's similar is that you still input orders. I know in retail that's more of a pharmacy technician responsibility, but we'll have a little bit more on that later. Um, they will verify prepared pharmaceutical products just like you do in retail. You supervise technicians and you will manage inventory. All right, so some ways that hospital pharmacy can be different than retail pharmacy is that only the pharmacist can input orders, and I'll explain a little bit more on that later too. Uh, the pharmaceutical products that you'll see in hospital pharmacy can be IV or chemotherapy or TPN, even a couple of other kind of smaller things that you're just not going to see in retail. Um, in hospital pharmacy, there can be a lot of technicians to supervise. Whenever I worked in retail pharmacy, I would have one technician, two technicians sometimes. I know some of the bigger retail pharmacies, there might be five or six. I'm sure there's some where there might be 10 technicians working at a time. But on any given day, working in a hospital of a decent size, there could be 10 to 15 technicians working that day. They all have different jobs and different responsibilities, and the ratios, the pharmacist to technician ratios are different in hospital than they are in retail. Um, the next thing is inventory management's a little bit different in hospital. Usually, you're going to have a buyer or someone whose sole purpose is to stock the pharmacy. There's a lot more inventory to manage. There's even a kind of a greater importance to make sure that you have all the pharmaceuticals you need. Because in retail, if you don't have something, you can just send somebody to another pharmacy or whatever. They might be mad at you, but it's not a big deal. In hospital, a patient might die, or they could become very ill if you don't have certain things. So usually there is a someone who is in charge of inventory management. Another, and this is to me anyways, was probably the biggest difference, is that there is very little communication with patients. Basically none. Um, uh, I guess there could be some positions as a pharmacist. Maybe you work down in the ER and you will do kind of med recs with the patients, or maybe you're kind of more on the clinical side and you will go into patients' rooms and you will talk to them. But as just a staff pharmacist working in the hospital pharmacy, you will basically never talk to a patient. Now, on occasion, a patient will call the pharmacy, usually from an outside. It'll be like an outside caller because they just Googled pharmacy and they found your pharmacy and they will call you. And that'll also happen kind of at night when some of the other pharmacies are closed. A patient has something going on, they have no one to call to, no physicians. The only person they can get a hold of is you at the hospital if you are the night pharmacist. So you'll get those calls like, "Hey, I took this medication and my stomach hurts," or whatever. But that's about it in terms of communication with patients. So very different. And then on the other side, while you get very little communication with patients, you will get lots of phone calls from, especially nurses, but physicians also. On any given day, probably get a 10 to 15, maybe 20 phone calls from nurses asking, should this be dosed now? Can this IV run with that IV? Things of that nature. And you'll get physicians calling like, hey, this patient's got renal disease, can they be on this drug or that drug? Or, even like, hey, you don't have this product, what product can we use? We get a lot of those kind of phone calls. Um, so yeah, you'll get a lot more phone calls from physicians and nurses. And then probably the biggest positive of working in hospital pharmacy is insurance is rarely an issue. At least, at least at the staff pharmacist level, you're not calling insurances. You're not running into insurance issues. Things aren't covered. Patients calling mad or whatever. Or hey, why wasn't my drug covered last month or whatever. That doesn't happen in hospital pharmacy. You won't get those phone calls. Sometimes maybe for like a chemotherapy, a patient will need something and their insurance doesn't cover it. But honestly, that's on the infusion center and the oncology group to figure out. Not That's rarely has anything to do with you. Um, there can be some insurance issues that the pharmacy will take care of, but that's higher level pharmacy director, administration kind of thing. So yeah, that's probably the best part of not working in a retail pharmacy is not having to deal with insurance issues. All right, so I think we'll take some of those things that we talked about already, and we'll go one by one, and we'll discuss them. And I plan on making a lot more videos of this. This is just a quick kind of intro to pharmacy. What does a staff pharmacist do? And then I kind of want to take each one of these topics and go more in depth in future videos, so that way the recording doesn't get too long here. But so in terms of order verification in a hospital pharmacy. The first thing that'll happen is that a nurse or the physician will order a medication, and they'll usually do it through the EMR program that the hospital uses. They can write it out and scan it to you, or fax it to you, or walk it over to your door. But most hospitals are on a zero paper, or they attempt to be zero paper. Everything should be entered through the system. So what you'll end up getting orders sent over through the system, and it'll come over to the program that the pharmacy uses, and then they'll verify the order, and then we'll continue to work on it. So what'll happen is you'll be working what's called the queue, and there might be 10, 15, 20 orders on it, and the order that the nurse put in through will pop up on your queue, and you'll triage it. You'll find out which order needs to be done first or which one you can wait on, because timing can be very important in hospital pharmacy. So it'll come over on your queue, and let's say it's a stat thing. You'll click on it and you'll click verify, and then you'll kind of just go through the process. It'll pop up in a screen, just like with retail. It's not very different here. And you'll check for allergies and see what their age is, and make sure that the time that the doctor or nurse put it in is correct. Dispense location. That I'll explain that a little bit later, but basically it can be dispensed from the pharmacy, or it can be dispensed from a med station on the floors where the nurses can just go and grab it out of it's called a med cabinet or a med station, or probably has a bunch of different names: Pyxis, Omnicell. There's a handful of other ones. I'm not sure how many, but the nurses can just go grab it out of there and give it. Or maybe it needs to be dispensed from the pharmacy, where maybe we need to make the product. Maybe it's a IV drug that needs to be produced in pharmacy by a technician, or maybe it's just a tablet that's not in the med station, so you'll dispense it from pharmacy. So you'll click on that. There's a handful of other things that you'll do in regards to the timing. Um, all order systems are a little bit different. So say a doctor puts it in as a daily product, and so it's an antibiotic that you want to give daily. Well, like the way that ours works is daily will automatically set it to the next day, because it's set at 9 a.m. So no matter what, it's going to start that next dose at 9 a.m. the next day. Well, if it's an antibiotic, they need a dose now. So, you'll change it so that the dose gets given now, and then the future dose will start at 9 a.m. the next day. So that way they get a dose today, and then start the daily dosing tomorrow. There's a whole lot more to that. I'll definitely make a video on that in the future. Um, and then so after you verify everything looks good. You'll click your submit button, and it'll be dispensed. Either the nurse can pull it out of the med station, or the pharmacy technician will get a label, or however different programs do it, and then they'll make the product in the pharmacy. All right, and then so then there would be the product verification. So you printed your label. Let's just say it printed in the pharmacy. Um, and now a technician will work on it, and when they're done working on it, they'll tell you like, "Hey, the product's ready," or you'll go check a table, or however it works in whatever hospital you're in. Um, so in the hospital, there can be many different products. You can have oral medications, just like in retail, topicals, just like in retail, IM, sometimes just like in retail. So that maybe it's vitamin B12 or whatever. But kind of when it gets to the IV push or the IV medications, that's where there's a difference. So you can have IV push products, and I'll probably do a video on this too. IV push, you just have like a vial, a little bit of NS or sterile water. The nurse will usually dilute it on the floor, and then they'll pull it out into a syringe and they'll give it right then. Usually 2, 3, 5 minutes is the infusion time, depending on the product. This this a lot of times will be like maybe a steroid or an antibiotic. Um, or morphine or things like that. Things that you can push real. It's called an IV push medication. You push it real quickly. An IV piggyback, on the other hand, it'll be something that's going to be given over a set time. So maybe you have a different antibiotic that you can IV push, and so you'll prepare an IV bag, maybe in 50, 100 mLs, whatever the case may be, and you'll send it to them, and they will run it over 30 minutes, and that's the end of it. Maybe it'll be Q8 hours over, each bag ran over 30 minutes. Um, so examples of that would be antibiotics. Let's see what else. Again, steroids can be an option there too. And then for continuous infusions, this one I get whenever I first got started, I confused it with piggybacks, but now it makes a lot more sense to me. Continuous infusions are going to be usually liter bags, and they just run. They run for a set amount of time at a set rate. So maybe it's just normal saline. So the doctor might just order normal saline ran at 75 mLs an hour. And so what you'll do is you'll verify that, and the nurse will usually pull, because we'll keep the normal salines in the med stations on the floors. The nurse will pull a liter of NS, and they'll set the pump at 75 mLs an hour, and it just runs. And when the bag is empty, the nurse will replace it with a new one, and it just keeps going. Maybe the doctor wanted 3 days of this, or maybe they even just wanted one dose, but it still would be considered a continuous infusion because you're just setting it for 75 mLs an hour and you just let it run until it runs out. Um, so that's kind of the difference. So kind of going over that again, an IV push will be very small volume, maybe 5 mLs. You'll push it over 3 to 5 minutes, whatever. The nurse will pull it out in a syringe and give it. An IV piggyback's usually going to be about 50 to 100, maybe as high as 250 mLs. And they will usually run it over a set amount of time, 30 minutes, an hour, hour and a half, just depending on the product. Continuous infusion, this is going to be a large volume bag, usually a liter or so, and it's going to just run at a set time or for a set amount of time at a set rate. 75 mLs, 125 mLs an hour, things of that nature. All right, and then the last kind of product, or the last couple products that you'll see, and I might even be missing some, but maybe chemotherapy, depending on how your hospital's set up. Maybe the staff pharmacy is in charge of chemotherapy, and then same situation with TPNs, total parenteral nutrition. Your staff pharmacy might be put in charge of making those two. Those last two ones, some hospitals will have kind of like a standalone chemotherapy pharmacy. Some hospitals have, they will just order their TPNs from an outside company and bring those in. But some hospital pharmacies will fill or prepare both chemotherapy and TPNs along with everything else. All right, then the next one in terms of supervising technicians is very similar to retail. The difference is there's just a lot more of them usually, and they have very different job descriptions. You will have a technician who will fill those med stations on the floors. They will gather up all the medications, and you will verify those medications, and then they will take them to the floor and load them up in the Omnicell. You will usually have a technician who will prepare all your IVs, all your antibiotics. Then you'll have someone who's in charge of the front of the pharmacy, the person who's answering the phones, checking the door, preparing the PO medications, things of that nature, getting the IV medications that the IV technician prepared and getting them ready to for the pharmacist to check, or giving them out, or tubing them up, or what have you. You may have someone who's in charge of chemotherapy, someone who's in charge of TPNs. Usually, the inventory management that can be done by both a technician or a pharmacist, or both, sometimes depending on the size of the hospital. Narcotics, usually that'll be a technician, and their sole job is to keep track of narcotics. They will also deliver the narcotics to the med stations sometimes. Um, but yes, they're in charge of the narcotics. The counts have to be completely correct and accurate, or the DEA will come knocking on your door. And then, etc. There could be even a handful of other job descriptions that I'm missing here, but those are the main ones. All right, and then a pharmacist working in as a staff pharmacist in a hospital setting will still have clinical responsibilities, answering physician and nursing questions. I kind of touched on that earlier. Understanding drug interactions. So when, just like in retail, when you're clicking in a new medication will pop up, or interactions, you have to know what's important and what's not, because almost every drug, when you type in, will pop up with something. Maybe it's just they have something similar on their profile, or maybe it's something important. You have to decipher, because you can't call the physician on every one of them. It would just be too much. You put in 1,000 orders a day. So you have to understand which ones are important and which ones you can ignore. Same thing with understanding the drug allergies and bullet point 4 there. Same thing. You, you'll see what's an allergy, and you need to be able to know whether or not that's something you need to call the physician on, or if it's something you can just ignore, or even if you do call the physician, you need to know the points that you need to make. If they have a penicillin allergy and they ordered a Rocephin, that's a third generation cephalosporin, you need to tell them, like, hey, it may not be, they may not have cross allergies. Maybe you can look back in their past and see if they got Rocephin before and it wasn't an issue. So you have to understand what to do in these situations. A major one that you'll see is renal dosing. Uh, this one's really not that complicated. I'll make a video on this too. You just take a drug that's renally dosed. You look at their creatinine clearance, and you can change the dosing, usually by protocol. You don't need to call the physician. Sometimes you may still need to, depending on what the hospital's protocol is. But that one's actually pretty simple. But I'll go over that in another video. And then the last one is just general dosing, whether it's an adult, neonatal, pediatric, obese, geriatric. They all have different dosing, and you need to kind of recognize. Basically, you just need to recognize when the dosing's wrong, and then you'll have to look it up. Like, nobody can keep everything memorized on the top of their head, but you can look it up easily. Be like, oh, they ordered this adult dose for a ped. Let me look up what the dose should be. I'll call the physician, and we'll get it changed to the correct dose. All right, so finally, in conclusion, while hospital pharmacy is very similar to retail pharmacy, it's still very, very different. I would say, from the outside view, or someone looking in, they might seem very similar, but whenever you get into kind of the nitty gritty in your day-to-day work, it's actually very different. Um, but yeah, so if you like this video, please like and subscribe. I will definitely be making more videos on basically everything I've touched on so far. And let me know if there's anything else you want me to review.